Welcome to Medica Nova Wellness Studio with your educational videos about optimal health and the most innovative and holistic approach to your well-being. Today let's explore how you can manage and heal your knee injuries with natural therapeutic tools. In our last video, I shared with you a plethora of information how to heal your muscle aches. Well, next to back pain, for example, knee pain is one of the most common complaints, especially among our elderly and young athletes. But knee pain is not always caused by accidents. It can be caused by arthritis, osteoporosis, maybe certain excessive exercises like running, marathon runners, and also repetitive movements. So in this video, I will share with you fantastic treatment protocols, which really gives you more of a lasting relief rather than just a band-aid situation. So enjoy this video. To stay updated with more ongoing videos, subscribe to our channel, share and like it, and also don't forget to click that bell as it notifies you every time I upload a new video. Have a look at our website, medicanova.net, at the online education, where you will find comprehensive study online courses in homeopathy, in health and wellness coaching, positive psychology, mental health, quantum healing, and so much more. And if you want to schedule your appointment, contact us at health@medicanova.net. So let's dive into this subject, how to heal your knee pain. Now, if you are experiencing knee pain, identifying this underlying cause of your pain is the first step, because the knee is actually a complex joint. Now, treating health conditions that might contribute to these inflammatory conditions like autoimmune diseases, maybe engaging more in appropriate exercises, as well as start more a sort of weight management program can help to find relief. The knee joint is quite vulnerable to injuries in general, and a knee injury can arise from a fall, an overuse, a misstep, even sort of a funny twist, can set it up. Athletes who play sports like soccer, football, basketball, often, experience knee injuries. So the knee pain describes literally any type of discomfort, and that's why it's important that we find out what part of the knee is actually affected in order to create a more targeted treatment protocol. But usually you have symptoms like sensitivity, maybe a throbbing pain, definitely swelling around the knee, maybe it feels hot to touch even. So there is a discomfort that gets worse when walking or doing other exercises. Definitely there is an inability to bear weight on the knee. You maybe also experience, especially if there's arthritis involved, maybe stiffness around the knee, which then reduces the ability for certain movements. Hard time maybe straightening the knee or bending the knee. There can be a weakness of the affected leg that you maybe feel the knee is giving away, so to say. So in general, we see a reduced range of motion. And then we have the unusual popping sounds, which also says, there's something off here. So the knee joint is formed by these interconnecting bones, cartilage, ligaments, and muscles where the major bones of the upper leg and the lower leg meet. The knee is actually the sort of biggest joint in the body, and it's called a hinge joint, formed by the femur, which is the thigh bone, and the tibia, which is the shin bone, and then the patella, which we call the kneecap. And I put some pictures up for you so you can see it more visually as well, which are then held in place with several joints as well as tendons. Then we also have, you maybe heard about the meniscus, which is this C-shaped, tough, almost like a rubbery cartilage, call it the medial and lateral menisci, that acts more as a shock absorber between the femur and the tibia. The knee also must withstand a lot of pressure and weight, from the upper body, as well as shocks. And it relies, therefore, on the muscles in the legs to keep them stable and strong. So you can see it's quite a complex situation. An injury can be, affect any of these components. And the knee pain is therefore referred in general as a patellofemoral pain syndrome or runner's knee, which describes pain and other symptoms affecting the area between the patella, the kneecap, and the femur, the thigh bone. Now, you can have acute pain, right? When it's caused by an accident. Acute pain means it starts but also has an end, right? Sort of maybe after a week you feel better. Or it can be chronic pain caused by maybe osteoarthritis. So chronic means it's ongoing. There is no end in sight, but we can definitely bring in helpful treatment protocols to manage this whole thing, and also you create a more quality of life here. So the causes are, yes, the injuries to the legs, and I will go a little bit deeper about the topic of injuries in a minute, but overall it can be arthritis, osteoarthritis, rheumatoid arthritis, where we have the more autoimmune diseases. We also can have like a biochemical form or biochemical problems in itself, such as a poor form or deformities or muscular compensations that cause actually the kneecap to fall out of its optimal position. So that can be done. So maybe it's good to look into like Feldenkrais therapy to really start looking at your posture and how you walk. Gout, is another one where we have an accumulation of uric acid. We also can have, like, it's called joint mice. It's a disorder in which one or more small fragments, maybe there was a fracture in the past of a bone or a cartilage, breaks off and remains floating then in the knee, sort of like joint space, which causes them the pain. We also can have infections, right, which cause fluid retention, swelling, maybe septic arthritis. Overweight, yes. Weight management is here very, very important. But also, I talked about excessive exercises, but if you're too sedentary, that doesn't help either, right? Because these muscles, they need to, be worked about. Otherwise, there's an atrophy. So not exercising or walking or stretching isn't the right idea here either. So let's talk about some knee injuries. They usually develop slowly, the pain in itself, but also they're hard to heal. That's why I want to give you some great remedies, how to sort of speed up the whole situation as well, especially if it's an acute injury. So it can be by a ruptured ligament, right? You haven't heard about maybe skiers or athletes experience that. A torn cartilage is very often, or then we have this inflammatory situation caused by the main overuse. So there is a name called iliotibial band syndrome. It's the irritation and inflammation of the IT band, which is the thick fascia or the tissue that extends from the pelvis or the hip to the knee. We also maybe have a torn meniscus, which is not uncommon. It's the damage of this rubbery, cushion, what I told you about. It's like a cartilage, which helps absorb the shocks in the legs. It's very painful. Patella tendonitis, it's caused by inflammation of the patella tendon, which connects the kneecap to the shin bone. We also have maybe knee bursitis. It's caused by an inflammation again by the bursa, which is a small sacs of, filled with fluid that is the cushion for the outside of the knees. Yeah, and there are great oils actually internally you can take to heal that. Then we have chondromalacia patella, which refers to the damaged cartilage under the kneecap. So you can see it's quite difficult. And then, of course, we have the common tearing of the ACL. It's the anterior cruciate ligament, which connects the shin bone to the thigh bone. Now, both traumatic and non-traumatic injuries commonly affect the ACL. And then, of course, we have the common fracture of the patella, the kneecap, if you have a sports injury. And then also I talked about this dislocated kneecap, which occurs when the patella slips out of its normal position. And that can happen with any movement. So usually the medical treatment would be that your doctor, maybe an orthopedist, will need to perform a physical exam, right? And he sees or she sees how you respond to the movements of the legs. Your pain maybe increases when the knee is moved in a specific sort of direction, or performing a movement like standing up, from a chair. It can therefore point that, something is going on here. You might also need an X-ray, a CT scan, an MRI. You maybe get prescribed compression or ice packs, or you have to elevate your knee, rest a little bit. You maybe get a knee brace, which helps just to get the sort of weight of the knee, as well as pain medication. There may be steroid injections, in not the last video, but the previous one I talked about occipital neuralgia, where steroid injections quite often are prescribed. And then we have the platelet-rich plasma injections, as well as surgery. All of that, I'm not saying doesn't help, but it also comes with side effect, or also can create a very long-winded healing process. And in this video, I want to give you, next to the orthodox treatments, also some solutions which speed up this whole healing process. So you can go back to your favorite sports activity. Now, if you feel pain in front of the knee, which is actually, we call it behind the kneecap, this is a sign of this patellofemoral syndrome. You're likely to feel pain when going from a standing or sitting position, and you may notice that the pain gets worse on the first movement, but then continued movement makes it better. And I will give you a fantastic homeopathic remedy in a minute, which this remedy just works like wonders, and it will stop the pain quite soon. Now, when you experience a torn meniscus, we talk about a different situation, and you probably will need surgery. You have difficulty walking, limited range of motion of what I said before. There may be an excessive swelling and stiffness. Twisting or rotating the knee is almost impossible. You also can't bear any weight. Again, here we'll give you also a great homeopathic remedy which brings down the swelling, stops the inflammatory situation, so you can maybe have a surgery, quite sooner. Because once you have these major injuries, and the swelling is there, your surgeon won't perform the surgery right away. Often it takes 10 days to 2 weeks to bring down the swelling, but you will have great remedies at hand to make that happen. Then we talked about the ACL, which is the first ligament that becomes tight, right, when the knee is straightened, and it can become torn if the knee is hyperextended, or from sudden stops maybe, or jumps or changes. in direction during physical activity. Now your knee can hurt, of course, all over. We have again the swelling, also the feeling of the weakness. So your knees maybe give out. You won't be able to bend or straighten your knee, walk downhill, change directions easily. It's very, very difficult and very painful. And also some people hear this usual pop, sound when they tear their ACL. There's intense pain. But in this video, I will now share with you effective natural solutions for how to start healing your damaged knee without adding all these side effects, and also just reduce the pain, create a more quality of life. So what are the natural treatments? Well, exercise and proper time to recover is the first one. Quite simple, quite common sense here. So although the muscles are weak and there may be stiffness, which is usually the leading cause associated with knee injuries, it's still important that you start, have daily exercises, slow, have some rest in between, do your ice packs, but it is important so the muscles don't atrophy. Physical therapy, it's very good. They give you specific stretching exercises, for the knee, because you do experience loss of flexibility, and it's very important to, in a quite a sort of like coached way, help you to get on the right track again. You maybe also bring in a good footwear, maybe some insoles. I mentioned the knee brace often helps a lot. And then the foam rolling, maybe you heard about that. It's very beneficial for breaking up the adhesions in the leg that contribute to knee pain, because once there is an injury, the body creates scar tissue. And that's a natural progression. And then unfortunately, you have to then have something to break up this scar tissue again, so the blood flow can happen. And this foam rolling, or usually the soft rollers are maybe in the beginning easier to handle. I put a picture up here as well, is maybe more advisable rather than the hard rollers. You also want to bring in an anti-inflammatory diet, right? Get away from the excess sugar and the alcohol. There are tons of videos out there on YouTube about anti-inflammatory diet. Dr. Axe is a great reference, like a good website you can check out. You also want to bring in some anti-inflammatory supplements. And the best one here is turmeric. I swear on it, it's fantastic. Really take it 2 to 3 times a day in the first sort of 10 days to 2 weeks, and then you can reduce the dosage plan maybe to once a day. Glucosamine and chondroitin, because we have ligaments and joints involved. You also want to bring in maybe an organic bone broth, collagen protein, yes, it's very important, but also omega-3 fatty acids to lubricate this whole situation. As a healthcare practitioner, I always look at the whole situation, the totality of the patients. So yes, you can have an accident, but there are it's not happened just by random. So I'm interested to know, what are you feeling? What's your situation? What's your marriage like? What's your work environment? What caused you to have an injury in the first place? So on the mental and emotional aspects, take a moment to reflect. What in your life brings you down to your knees, right? Is there something, a situation in life that makes it difficult for you to make a decision, right? Because not making a decision means I don't know which direction to go, and the knees get affected. Why do you feel off balance in your life? Why do you feel easily swayed? Especially if your knees give out. Is there something in your life where you feel like, I don't feel so confident here? Are you collapsing under the weight of your responsibilities? So your knees want to bend. Do you get the idea here? There is a connection. It's not just all based on arthritis or gout. Yes, with gout, you have to change your diet. It's a direct link, but there's often something else behind. How about you are cracking in life and you constantly have these cracking sounds in your joints, right? What is the inner conflict? And a good practitioner will also have a look at these aspects and also give you the right remedies. And in this case, homeopathic remedies not only focus on the physical complaint, but also on the mental, emotional aspects. So you can hit two flies in one, right? That's really where we want to have a good, solid protocol. Homeopathic remedies, they offer quite a promising scope here for managing cases of knee injuries. They help to reduce the pain, the swelling in the knee I talked about, especially following an injury, and therefore promote more of a rapid healing. Homeopathy is, I would say, recommended more for minor knee injuries to mild and moderate intensity. Of course, if you have a torn ACL, you need surgery. But even here, you can sort of like bring in homeopathic remedies next to the orthodox medical treatments. It just gives you more of a symptomatic relief. They also boost the body's natural healing mechanism. So it activates your vital force, your life force to kick in faster, despite, you have to take painkillers. Now, once the self-restorative forces in the body are boosted and the body recognizes, okay, let's go to work here, self-healing in the injured area begins. So you not necessarily always rely on prolotherapy injections. The body knows how to do that. It just needs a sort of reminder. And gradually self-recovery happens along with the symptomatic relief. And that's really what we want here. The remedies which I will suggest in a minute with you, they are referred from Dr. Vika Sharma, but also from my own practice, Medica Nova, where I see quite a lot of patients. I live here in a mountainous area, and the ski season is coming up not too far around the corner, and I have a lot of skiers and snowboarders with head injuries as well, of knees injuries, and these remedies are fantastic. Now, of course, I give you remedies which you can purchase over the counter and online, but it's always good to contact your professional homeopath or to schedule an appointment at our practice, Medica Nova, at health@medicanova.net. So whatever happens, the first remedy, either from a fall, an injury, a twisting, a sprain, a strain, a blow to the knee, the first remedy you think about is Arnica montana. And here the potency is 200C. Now, these remedies are based on plant, minerals as well as from the animal kingdom, but here it's mainly plants. They come in Latin names, Arnica montana, and behind that there's a number, and that is the potency, the strength. Because an injury is usually quite intense, right? It shocks you. It also affects the mental and emotional aspect with the shock, and Arnica montana will heal both. the mental, emotional shock, as well as the physical blow and the shock, the tissue shock, and that's why it's so wonderful. Usually over the counter you get different potencies like 6 and 30 and 200 usually, for the layperson, but here I recommend 200 to, get the first layer off the table, so to say. Now, arnica is the leading remedy for treating a knee injury arising from a fall, a trauma, blow, or blunt injury even. It's helpful for acute and chronic conditions, right? So even if the fall was maybe weeks ago, you still can take it and it will address that frequency within your cellular memory bank. The knees feel extremely painful, sore, right? Bruised. Bruise is a big part here. And the person also feels a little bit afraid to even get touched, right? Because it's so sore. It's an intense pain. As I said, there can be swelling around the kneecap, feels a bit like dislocated. And it's also the first remedy. Let's say you have a fracture or an ACL is torn and you need surgery. It will bring down the swelling much faster and get the internal bruising out of the way so you can have a successful surgery. There's often no strength in the knee anymore when you walk. As I said, it's the first remedy which comes to mind. And for an adult, I would say at least one tablet 3 to 4 times a day for the first 5 days or a week, just to bring it all down, and then continue with more appropriate remedies. But then you maybe have a surgery. And even after the surgery, right? Because that's again another shock, another invasion. You maybe want to continue with arnica first, right? But there is something about that when you go straight into surgery and take arnica, I wouldn't necessarily recommend it because doctors have a liability and don't want you to take arnica straight before you go into surgery. So there's a little bit a sideline here, but you can contact me and I can explain that to you. But usually give yourself some time, the first 5 days, take the arnica, then have a rest, and then you go into surgery. Now, I mentioned that you can also have a knee injury or a knee pain caused by overuse. So it's not just a fall or blunt instrument, it's like a misstep. It's like a sudden twist, for example, can cause it. And we have a remedy called rust toxicodendron. Now here I would like you to get the potency 30C. It's an excellent remedy for knee injury arising from overuse, right? A misstep or this sudden twist. There can be pain, there can be swelling as well. But here the pain is more stitching, right? Or burning type of pain. It's different, it's not just sore. Motion helps to relieve the pain, but I mentioned to you that there is this patella femoral syndrome where the first movement, getting up from a chair is really painful, but continuous movement is better. That's the remedy. Rust toxicodendron 30. I would say 1 tablet 2 to 3 times a day and stretch it out for 3 weeks, 4 weeks. It's a fantastic remedy also if you have arthritis in your knee, rheumatoid arthritis. It's a given, it's a godsend. I mean, I know patients, they get in the car and they have to sort of stretch out their leg in order to put their foot on the gas pedal. Well, it's really painful. Or they were driving for a long time and then get out of the car. It's almost impossible. Rustox will help here. Then I also talked about a sprain of the knee. That's a little bit different. Then we have almost like tendinitis, sore, aching, bruise pains. The remedy here is called Ruta graveolens. Fantastic too. 30C. It's more for sprains, right, where the tendons are affected. People are at that point, they're unable to bend the knee joint. There's a sensation of contractions in the tendons of the knee. The knee joint feels also very weak. So we have arnica for the fall, for the initial injury. Rustox more for sort of like twisting and overuse or misstep, whereas Ruta is more for sprains of the knee. Now let's say you don't know what it is. I would start with arnica, then maybe have Rustox followed first for another week, and then if that doesn't do it, then follow it up with Ruta. It's not good to take them all at the same time, but that would sort of hit one or the other if you're not quite sure if your tendons are affected or is it the ligament. We have another remedy called Bryonia alba, also a plant. I would do the potency 30C. Now here we have exactly the opposite symptom and the keynote as in Rustox. Bryonia alba is indicated when you have knee pain from any slightest movement. Right? With Rustox is the first movement is really painful, but continued movement makes it better, not with Bryonia alba. It's like any slightest motion of the knee makes it painful. That can be walking. Often you can see the knees, they knock together even when you walk. The knee is very painful and it needs complete rest. Right? You want to lie on the sofa with ice packs. The pain can be of a drawing, tensive, shooting, cramp-like, stitching nature even. And it also can extend down the leg, right, further down. So the key indication here, the keynote here is the pain gets worse on any slightest movement. Now, we talked about fracture, right? I mean, the bone cracks. So again, you start with arnica, right? Because it's a shock to the system. And here would take arnica 200C for adults, maybe 1 tablet 3 times a day, take it for 3-4 days. Now, if you have a child, bring it down, arnica 200, maybe only twice a day or once a day. The younger the child, in age, the less you bring in these remedies. But here, of course, contact Medica Nova for more guidelines. But then you follow it up with a homeopathic remedy called Symphytum officinale. It's a wonderful remedy. It's a specific remedy for managing cases of fractures. It's used as a prime remedy in homeopathy for the aid of healing for fractured bones. Now, what does it do? It boosts the activity of the fibroblast cells to help the healing of the fractured bones speedily. So it supports the fusion of the broken parts, really coming together in a nice way, but make sure that your knee is set in the right place because, hey, it speeds up the healing, so you don't want to have it, broken again in order to align it. So, of course, you have your doctor here. But Symphytum can be used with conventional treatment protocols, which I really like for the prompt healing of a fracture. So it not only resolves the pain that remains at the fracture site, even after complete bone healing. I've seen that a lot. Also, Symphytum should be selected to manage cases of fracture of knee bones along with conventional treatment. Absolutely. Now, we talked about another situation where, yes, there maybe is an injury, but there can be also an infection. And suddenly you have this blown up, swollen knee, and you don't know how to heal that. So there is a marked swelling around the knee. And here we have a remedy, and it usually works. I tell you that. It's called Apis mellifera. It's made from the bee. Apis means the bee. I would say 30C as well. It's a remarkable remedy to treat marked swelling of the knee in cases of an injury, but it can be also, from an infection. We have marked swelling, soreness, sensitivity again. There may be pain of a stinging or shooting nature, along with this burning sensation. It can be also felt in the knee, with these general symptoms which I just said. It's considered to manage swelling of the knee that occurs in cases of injury. There may be a stinging pain, a shooting, a burning like pain. So I would say one tablet maybe 3 times a day, right? Do it for 10 days. We probably won't need it for 10 days. So probably a week is often easy. Think about oedema, right? It also is a great remedy if you have swelling around your ankles, which could be a cardiovascular system ailment. So I'm not saying it, but any swelling, any oedema in the body, and especially around the knee, Apis is a good remedy. So I hope that this video has inspired you to seek out more natural solution for your acute as well as chronic knee pain and injuries and the accompanying symptoms. Now, if you want to learn more about the principles and concepts of homeopathy, have a look at our website, medicanova.net, at the Medica Nova Online Education, where you will find 4 months, 16 weeks comprehensive study course. It's an online course called Thriving with Homeopathy, a practical guide for the whole family and beyond. And although it's an online course, I will guide you step by step through the whole beautiful study material. I'm with you all the way, and on completion you will get a certification which helps you with continued education, of course. So refer to the course link down in the description box. And till next time, much love and take care. Your knee pain can be healed, and I've done it many times. And yes, as I said, it's a complex joint, but it can be healed. So take care.